Across our state, a movement is beginning from city streets to winding rural highways. The journey will stretch mile after mile, city after city. We're traveling to every corner of Louisiana, meeting residents where they are. And each stop will bring new opportunities to share knowledge, deliver resources, and build momentum in the fight against childhood obesity. Introducing Greaux Healthy, a public service initiative focused on preventing and treating childhood obesity in Louisiana. Our work is built on a foundation of over 35 years of transformative obesity research from Pennington Biomedical Research Center and the backing of the state of Louisiana. It's a union of knowledge, resources, and evidence-based solutions to help grow healthier generations for Louisiana. In schools, we're helping students develop the building blocks for health behaviors that last a lifetime. In communities, we're providing healthcare providers with the tools, training, and support they can use to help families create healthy futures for their children. In homes, we're helping parents and children adopt healthy habits that encourage active and balanced lifestyles. This is more than a journey. It's a movement, and we won't stop until every child has a healthier tomorrow. So join with us, because together we can drive change. Learn more at growhealthy.org.
All right, good afternoon, everyone. Thank you so much, Ryan, for the introduction and for sharing this video with the group. Thank you, BR Press Club, for having us here today. We're really excited to share more about Greaux Healthy. And I left my clicker over here. Come back and grab it. So I want to start with acknowledging our leadership at Pennington Biomedical. First, our Executive Director, Dr. John Kerwin, and Dr. Peter Kaczmarzyk, our Associate Executive Director, as well as Chief Scientific Officer for Greaux Healthy, who's also here with us today. Thank you for coming. We have a few other team members here today. We have Pennington Chief of Staff, Matthew Ratcliffe, Lauren Goddard, and Lindsay Blanchard here with us. So thank you to all of you, as well as Filey Communications, for giving us this opportunity today. Here is a bit of a snapshot of all the different things that we hope to cover and share with you. First, we'll briefly touch on a history of Pennington Biomedical, introduce Greaux Healthy, share with you about what resources it has to offer, how we plan on meeting people where they are, what's up on the horizon ahead, and how you can be the reason Louisiana kids grow healthy in the state. All right, so a little bit about Pennington Biomedical for those of you who are not familiar. So Pennington was founded by the generosity of and vision of Doc Pennington and his wife in the early 1980s. They wanted to build a facility to house global leaders in nutrition. Our vision today is saying to lead the world in promoting metabolic health and eliminating chronic disease through scientific discoveries. Our mission is to discover the triggers of chronic diseases through innovative research that improves human health across the lifespan. Our focus aligns with Louisiana's health concerns such as obesity, diabetes, cancer, nutrition, and healthy aging. Pennington Biomedical has grown into a leading research institute known for its interdisciplinary approach, commitment to fostering scientific research that enhances human health and well-being. We are committed to addressing critical health challenges and improving public health through innovative research. Through this Greaux Healthy initiative, we are propelling the translation of this innovative research into community action. Our focus for the Greaux Healthy initiative is to prevent and treat childhood obesity, as you've all heard. We're doing this by creating evidence-based tools, resources, and programs that promote better health for children of all ages, all the way from pre-pregnancy through young adulthood. Our resources are available for families, as well as early childhood education centers and schools. Other resources are there to advance obesity care across health systems in our state and to educate communities. So a little bit about childhood obesity. Why this initiative and why now? Childhood obesity is a public health crisis in America, with 1 in 5 children having childhood obesity. In Louisiana, that number is even higher. 23.1% of children in our state are living with obesity. This costs the state nearly $127 million annually. Louisiana has the 3rd highest rate of childhood obesity in the United States. I think this next data point is really important. 70% of our children and adolescents with obesity will have obesity as adults. If we can prevent and treat childhood obesity during those younger years, we can make a big impact in overall health across any age in our state. For the first time ever, our younger generation is expected to have a lower life expectancy than their parents. I mentioned cost earlier, but here's just another breakdown of that. Annual medical cost associated with childhood obesity is $116 higher per child than those with a healthy weight, and $310 higher for children who suffer from severe obesity. In a recent survey of Louisiana parents, we learned that childhood obesity was identified as the #1 health concern, outpacing smoking, vaping, mental health, high blood pressure, and diabetes as having the most harmful impact on the state's children. So let's take a look and see what are some of these resources that we're developing. Many of our resources you can access online on our website, growhealthy.org. Our resource library is an ever-growing site that has numerous downloads to support parents, teachers, and healthcare providers. Childhood obesity isn't always the easiest conversation to have, so we're building resources to help have those conversations to start making change. Family resources include topics such as healthy pregnancy and weight gain, infant and child nutrition, conversations about weight concerns, modeling healthy habits, making healthy eating easy, and taking charge of screen time. And this is just a sample of some of the topics we have available. The Grow Healthy Provider Hub offers practical resources, training, and evidence-based strategies for pediatric obesity care. So this is really tailored to physicians, nurses, dietitians, social workers, those working one-on-one with children and their families. We have a childhood obesity prevention evaluation and toolkit for Louisiana providers that supports the application of newer clinical practice guidelines to make treatment easier for our providers. In addition to that, we offer them free continuing medical education credits, live webinars and workshops, on-demand training courses, expert-led sessions, and a repository of supplemental materials designed to integrate these best practices. The Grow Healthy Early Childhood Education Training Series, which is used for child care centers or daycares, there's numerous names for them, are developed to ensure that our providers with our youngest generation are aware of best practices around indoor play, outdoor play, and screen time. We know during these years, helping our youngest learn how to move, develop motor skills, and enjoy play is really important for future physical activity levels across life. the lifespan. And so currently we've been partnering with the Volunteers of America in 9 parishes across the state to conduct these trainings. We have worked so far with over 150 centers and trained providers on these trainings and best practices, and look forward to expanding this reach across the state. We also have a school health program that focuses in the elementary and middle school space. This last year was our first year to test it out. We worked with 19 schools across 3 different parishes, trained right over more than 100 teachers and administrators on the classroom curriculum. But this program includes a tremendous amount of resources for the school setting. A lot of them are listed up here on this slide, but trying to help and provide support to teachers by providing materials that are aligned with the ELA, PE, and health standards that they're already accountable to, ensuring they have resources to teach in the classroom, but then also activities that they can do in the PE setting or during recess to encourage physical activity, and then opportunities for them to share information and resources and activities with parents, so things they can send home with the children. And all of this is available on our website for free download for schools. So how are we going to start meeting people where they are? Certainly in this last year, we've done a great job of connecting with local partners to learn what's the best way to develop and adapt these resources for real-world use. And so we are really excited to be hitting the road starting this month. We're going to be traveling across the state. By meeting families where they are, we're learning more about their health and behaviors to help better shape programs and resources for children statewide. Over the next 12 months, we will visit all of the LDH-9 health regions across the state. And our goal there is to really share the resources, build support, and inspire communities to take part in growing healthier generations. Our Healthy Moves bus, which you saw in the video earlier, sorry it couldn't be here today for you all to see in person, it's really fabulous. But it is making these resources accessible to communities statewide, providing the opportunity as well for families to participate in Pennington Generation. Pennington Generation is recruiting over 1,500 families in our state to learn more about the impact of lifestyle behaviors and the relationship that that has with the development of unhealthy weight gain and obesity. So it's really going to be a formative tool that helps to shape future research projects as well as resources for families across the state. So what's coming up next? We are constantly continuing to develop new resources. Being a research engine here for over 35 years, there's lots of research, lots of opportunity to translate programs for Louisiana community use. And so we'll continue doing that. We'll continue reaching out to different community partners. And we'll be soon releasing some new resources that are technology-based, based on some of our research that's been done using different mobile applications for families, for pregnant mothers, to really help improve the health of Louisiana. So really the ask for you all today, and the reason why we want to share Grow Healthy with you, is that we really encourage you to be the reason, if it's not all the children in our state, at least one child in our state grows healthier. You all can play a role in that. You play a really important role in kind of building that legacy of health for our future generations. So ways you can do that: participate. If you are, or if you know healthcare providers, you can encourage them to go to our website and participate in some of the free trainings and resources that are available to them. If you know or you are an educator, you can encourage them, even your own child's schools or grandchildren's schools, encourage them to use our resources and start these programs that are available to them. educate. It's important to learn about the issue of childhood obesity, regardless your background or industry that you work in. What you can do through Grow Healthy in teaching children or those you encounter with about healthy habits. You can share with patients, colleagues, administrators, families about the resources available, and share a little bit more about what Grow Healthy and Pennington are doing. And then, of course, engaging. You can follow us on social media. You can sign up for newsletters to be on the lookout for what's on the horizon and additional information to follow. So these are our different social handles. And then even on this last slide, for those of you that are interested, if you scan this QR code, you'll get some of these great images around childhood obesity has met its match, as well as a couple of other taglines that you can post on your own social media page to really start spreading the message and to help us in this fight against childhood obesity. So I'm going to pause now and am open to take any questions that you may have. Yes?
So thank you. So following along, I see education, engage, enroll. So what comes to mind, and I'm not sure if you covered this, is this, you need people to spread the message. Y'all created the message, you need people to spread it. Is it something to where, let's say, kindergarten, first grade, second grade, a school can, the same way moms and dads sign up to be the room mother, that they can go through the training and then talk to the classes. They can reach out to Pennington, get the material, and then they can take it upon themselves to teach this material to the kids in that class for the teacher.
Yeah, that was a great question. So he asked, is the school health program kind of flexible in the sense that even if it's maybe not the school teacher but a room mom, could they engage with these resources and materials and make them available in schools? And the answer is absolutely. So anyone who has contact with the schools, has the ability to engage with the schools in that way, can certainly sign up to get our school health program materials, and we'd be happy to work with them on how they can adapt and use those within that school setting. Mm-hmm.
When you take your bus around the state, what locations do you go to?
Great question. So she asked when we are traveling across the state, which locations we're going to be going to. So we are actively developing that out a few months in advance. So we know that in mid to late July, we're going to be traveling up to Region 7, the northwest portion of our state. And so we are right now looking at a variety of options and community partners that we can make stops along the way during about a week time frame. So we're talking to our existing partners, we're looking for new partners, and going to make those decisions kind of as we go across the state.
So what would be an example of a partner? Do you go to community centers? Do you go to churches?
Yeah.
Do you go to schools? What kind of other than health?
So I'll use this week's roadshow as an example and kind of tell you about what we're doing this week. So tomorrow we're going to be at the Ascension Parish Library, the branch in Gonzales. This week they're hosting their dinosaur experience, and so we know there's going to be plenty of families there attending the dinosaur experience. So we're going to be there during the time frame of the experience to be able to communicate and engage with the families that are coming for that event, as well as we'll invite several different types of community partners to come and meet us there so we can share and tell them a little bit more about Grow Healthy. On Wednesday and Thursday of this week, we will be traveling to several different healthcare provider offices in North Baton Rouge, Point Capee, and the Felicianas, stopping in to make sure they are aware of the resources that we have at no cost for them to be able to access. We'll also stop in at both the EBR and West Baton Rouge City Council member meetings this week to share resources with them. And then we'll end the week Saturday at the LSU North Clinic here in Baton Rouge. They're having their annual Go Get Healthy event that pulls in a lot of community members and families. So we'll be joining them on Saturday. So that's how this week is shaped out, and so we'll be looking for very similar opportunities across the state that allows us to hit multiple parishes in each of the regions. Yes, ma'am.
Louisiana is facing the possibility of some major cuts that will affect food insecurity with our high levels of poverty. Are you all in many ways, I'm sure, addressing that particular issue? And could you talk to that and the substitution, for example, of less expensive foods over others and so forth?
Right. So I think her question really speaks to food insecurity is certainly a challenge here in our state, and to what degree is Grow Healthy addressing that? And so Grow Healthy, along with its partners, are working to expand access and reach of resources. And although our resources aren't directly food, it's certainly the knowledge on how to connect and access healthy foods. So we have partners with, for example, Feeding Louisiana. We recently partnered with them and helped to identify, based on the foods that are available to families, how can you put together healthy meals and recipes. And we have a recipe book together with them. Other partners that are across the community, we've worked with the ag centers. We've also, in our school setting, providing education to the teachers to help them know about what food services are available to their children. As you know, hungry children is certainly a problem, and it's part of childhood obesity. So it's really through our partnerships with partners that are in that space where we can help connect the dots to those resources. Mm-hmm. Yes.
How do you measure your success?
That's a great question. So how are we measuring success? So from a short-term perspective, our goals really are around increasing engagement and participation. Have we been successful in expanding that reach and access and engaging people from all corners of the state? From there, we'll be looking at specific programs and evaluating their impact on the setting in which they were utilized. From a more long-term evaluation perspective, of course, our ultimate goal, we kind of call it Vision 2035 internally, is to really see an impact to childhood obesity prevalence. And a lot of that is going to have to do with our ability to pull partners together, because certainly childhood obesity is a larger challenge that requires a multi-sector approach to impact. Yes. Great question. So the question was, what is the leading cause of childhood obesity? So obesity as a whole, there are many factors that contributed to it. And I don't know if you could exactly pinpoint one leading cause, but what we do know is that the combination of lifestyle factors such as nutrition and physical activity, environmental factors such as the ability to access some of these things as your lady sitting next to you just mentioned, in addition to some genetic components, they all come together and play a role in causing childhood obesity. What we do from a prevention perspective with the Grow Healthy, we're offering opportunities for the places and spaces that our children spend the most of their time, early child care centers and schools. We're offering them the ability to provide good, factual health and nutrition education and information to really empower children starting at a young age to pick up on some of those lifestyle behaviors and habits. And then our hope is that by equipping the medical community with the latest community and clinical practice guidelines for the treatment of childhood obesity, that those things will come together to really make an impact on those various factors that cause childhood obesity. Okay. Well, thank you all so much.